Why? To prevent your species. So if it's a hostile environment, you will produce 10 children, 5 will die, 5 will remain, so you are there. When nature knows that all your 5 children are going to live, nature will not let you produce more than 5. Got it? And that's how what is happening even in India. So we are making environment good, we are making them live longer, so their reproducing capacity going down. And how will the reproducing capacity go down? Some hormonal changes would happen, some libido disorder should happen, because the best way babies are not made or not born is to keep them away. Keep them means keep the couple away. So there is a joke, WhatsApp joke, it's a WhatsApp joke. So a teacher was narrating the story of Lord Krishna. I belong to Mathura, so let's take one story of Krishna. So teacher was narrating the story of Krishna to the students and telling that, you know, the 8th son of Devaki was supposed to kill Kans. So Kans, then Narad came in, Narad told, you know, from where you will count, from here, there, and you know, Narad was like, he wanted to increase the sin of Kans. Kans के पाप इतने बढ़ने चाहिए थे कि उसको मरना ज़रूरी था, उतना पाप होना चाहिए. You know, this is all the mythological things. And then Kans killed every son of or every child of Devaki, right? So a very smart boy asked the question, when Kans knew that Devaki's 8th child is going to kill Kans, why did he keep them together? Why didn't he keep both of them in different cell? If he would have kept them in different cell, there was no point of getting 1, 2, 3, 4, 5, 6, 7, 8. Logical question. Here's the logic. But again, some logics have no answer. Right, sir? Somebody would have done that way. Forget it. So how the reproductive capacity will go down? By some hormonal changes. Hormonal changes which will bring at least 2 things: decreased libido in both men and women, and decreased ovulation or spermatogenesis. And both of them somewhere are linked to your hormonal changes. But when the hormonal changes would happen, the quality of life will also disturb. Right? So the cost of longevity what we are paying now is infertility, and second is the altered quality of life, both of them secondary somewhere to the deranged sex hormones in your or our body. And when we talk about the whole nation, we are talking about in the whole nation it is happening. Maybe our average testosterone, if we count, nobody has tested it, but I am very, very sure it will be lesser than if we count with our previous generation. Now this movie came, Badhai Ho. Now look at the story, like, you know, they were, what would be their age? You know, have you seen Badhai Ho, everybody? But in the past, it used to be the same thing. My chacha and my cousin are of same age. They are, right? Ulta, my cousin is elder than my chacha, my real chacha. And my bua son is 1 year elder to my chacha. So this used to happen before, right, Dr. Jaria? But in Badhai Ho it became a whole story, oh my God, how can it happen? How can it happen? But it's a truth, it can happen because that person is young. But we are not ready to, now this generation is not ready to accept it. We are not ready to accept it that, oh, it can, no, it should not. So some changes are happening, you know. Now, so these 4 things what we are trying to deal in aging. Then comes symptomatically what are you going to treat? A patient is coming to me with fever. Symptomatically, a fever can be anything. It can be typhoid, it can be malaria, it can be dengue, it can be chikungunya now, or influenza. But one thing I have to do, I have to give symptomatic improvement to the patient. So paracetamol is going to be my standard in every, even dengue I'm going to give. Influenza also I'm going to give. So that is definitely sure. The definitive treatment will be after the diagnosis, but that has to be given, paracetamol. Same is for aging. If anybody is coming to us, what we are going to treat? We cannot talk only subjective thing, objective. So here comes, so there are both statistical and phenotypic components of aging, and the phenotypic component of aging are now divided arbitrarily in 2 parts. One is the primary aging changes. Those are sarcopenia, our target. Sarcopenia is loss of muscle mass, that is our target. Grey hair, your target by whatever mean. Oxidative stress, our target. Increased peripheral vascular resistance, target of Dr. Jaria, right? Hypertension, coronary heart disease. Then comes age-related disease. So one is the primary aging changes happening in the body, and second is diseases happening as per the age. So dementia, we all are talking about dementia a lot now. Osteoporosis, as soon as we talk about menopause, the only thing which comes first in the mind is osteoporosis. Why you should give HRT to a menopausal woman? Why? One definitive reason is it prevents osteoporosis, and there is no debate on it. For osteoporosis in a menopausal woman, estrogen replacement therapy still is the gold standard. Rest all are secondary, bisphosphonate, calcium, vitamin D, blah blah. ERT still is the best, undebatable, undebatable. Then arthritis, how many of you are dealing with arthritis? We all. Now you do whatever, you want to do a knee replace or a joint replacement, you want to go with anti-inflammatories, you want to go with stem cell, or you want to go with that some cyclotron, that machine is there, right? Some sort of an MRI type, some photon emission. It's a good machine for very expensive also for osteoarthritis. Insulin resistance.